Hello, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And once again, we are joined by Dr. Chotani. Thank you so much, Doctor, for being here. A lot to discuss with you today, especially after the president outlining those guidelines yesterday for opening parts of the economy up. First, want to get your overall reaction to the president's plan.
Well, thank you very much for having me again. And it's a pleasure seeing you. I listened to the president's plan, and actually I have it all printed out. I have gone through it in detail. I believe that the plan itself is a very logical plan, step-by-step plan. It is a phase-in, phase-out kind of a plan that, we have to open our economy in some capacity. We've got to get people, go to work, and people should get out. But caution is part of this particular plan. And what is really good is that if there's a 14-day decline in number of cases, and then there's a 14-day decline in the rate of the testing, because one has to really of course Dr. Fauci was with him, and CDC folks are with him, and all these brilliant people working together in terms of putting something which makes actually very good logical sense to me. 14, because each state has a different amount of people that live over there. So when we calculate the number of tests that were done by million, if the tests are coming negative more and more in one state versus other state, those states have the opportunity to start relaxing some of those quarantine type issues. Now, the best thing about the plan is that the president has allowed the governors of the nation to make independent judgment. So that is very critical, and I think that was a point that the governors wanted, because each state is having a different effect because of the disease. Not only that, each state has a separate type of a healthcare system. Some states have excellent healthcare system, like for example, California has ventilators that it can give out. Other states do not have that capacity. So each state is going to take a look at it, but it's a good roadmap, right? It's an excellent roadmap to recovery and going back and starting our economy back and starting the building of the nation back one more time.
But how do you ensure that when we do in fact open certain sectors of the economy, that it is going to be safe for people to go outside of their homes and to return to their jobs?
So it's incumbent on the health departments, and I believe that the president has clearly indicated that there is going to be a tremendous amount of support to the health departments to develop a very robust surveillance system and have individuals who are going to be trained for contact tracing. So, right now the health departments don't have that type of a capacity because it was never needed in such a large number. So now they have to get people who are going to be essentially trained, and it's a very simple process to train them. It's not. You don't need a PhD. Train them. And most of that work does not require somebody to travel from point A to point B. That can be done over the phone and, on WebEx or something like what we are doing right now, calling people on the computer and asking them, if you're sick, what is going on? How many people live in your family? How many people are sick? How many people were you in contact with? And you're sick now, you're positive. So who else were you in contact with during this particular time? So all of that work has to be part of the equation. Unless that happens, we will not know exactly what's going on in the community. Then one other thing that I believe was mentioned, if it was not mentioned, I heard it, and I'm a solid believer in that, that we've got to have sentinel surveillance systems all across the nation. Hospitals are a very, very good point where you can do sentinel surveillance. You can do surveillance at places such as CVS and do testing over there. So, across the nation, across a state, one has to pick certain areas where there is high density, and then you start looking at small groups of people. That kind of gives you an indication of what is going on in the larger community. You can, if it's done appropriately, you can somewhat generalize the results. We do the same thing for influenza. We have sentinel centers, and we do sentinel surveillance, and that gives us a clear picture of what is happening in our nation, and that is exactly what we are looking for over here. If that is established, then we are in good shape.
Let's talk about what we're seeing across the country, because, Doctor, there are still some states that have a very low number of cases and a low number of deaths. Help explain why that might be happening and if there are lessons to be learned there.
So that's a very good point. And, we are still learning from the disease in a big way, and we are still appreciating what's going on. But one of the things that is coming out is that certain states have a higher percent of people that are being tested. So obviously, when they have a higher percent of people that are being tested, the numbers are going to be higher. But when you look across, for example, the state that you're in, California. So in California right now, it's a very large state. You've got a very large population over there. The number of testing is not as much as, for example, in states that have not similar number of cases, such as Michigan, Florida, or Illinois. And the governor has said that by the end of this month, you should have the capacity to do 750,000 tests per day. I'm sorry, not 750. That would be a month. Sorry. So So it's gonna ramp up in a big way. And once that happens, we will be. You can start looking at what's happening with the disease. You can identify people early who have the disease. You can provide interventions if there are interventions, or you can actually monitor them for the intervention. So that then what's going to happen is that you will not have as much burden on the hospitals if that's the case. And so everything improves in a big way. So the two critical things is to have a very robust surveillance system for all of this to work, what the president has said. And that's incumbent on the health departments. And obviously the administration has said that they will provide support for that, and they are providing support, and hopefully they'll provide as much support as possible. The second thing is to have this testing done in a much wider, bigger numbers, so that we can identify what's going on. This also will help us in a big way because, for example, if we find out that one state where they're testing, the numbers of cases are not that high, and we see the numbers of casing declining, as has been said for 14 days, we can expedite the three-phase plan, right? I mean, in some states, it might take more than 14 days, but we might be able to do it in 12 days if all of a sudden we see something really, really going down over there and seeing less numbers. So if we can do that, then I believe that the nation would benefit in a big way. And I do believe that the administration is very clear that they are going to support this initiative.
But it seems as though a lot of this hinges on expanding testing, and there are still concerns about the lack of testing that is available. So why not perhaps wait until we are in fact able to ramp up testing to then sort of sit back and say, okay, now we have enough people being tested, we have a more accurate look of what's actually happening before we talk about reopening certain segments of the economy?
Very, very good point. But, I believe in America, and I believe in the manufacturing in America, and I believe in the innovation in America. And I believe that when the manufacturers in the United States hear that, there is going to be a solid initiative from the government to support this, manufacturing will ramp up. The critical problem that we are having right now is that, we were so much dependent upon China. And we've always been dependent upon swabs and things like that from China. This is a lesson learned that we've got to develop things ourselves. We've got to have manufacturing in the United States of America and not be solely dependent upon other nations to provide us with all that stuff. Having said that, now we're moving in that direction, and I'm very happy that we're moving in that direction. The other thing is, we've got these rapid diagnostic kits, and, market has been flooded with that. And there's some kits that are good, some kits that are not that good. FDA is now, I don't know how many kits they have in the queue over there to be validated and given emergency authorization use or given approval. They're going through that as quickly as possible. And Dr. Bob Cadillac's office, which is for preparedness, is working very hard to get all those things done, and then FDA is working very hard to get all of those things done. So everybody's working as hard as possible. Now, if with all the things that are going on, unfortunately, there's no magic wand that anybody can have. I wish I had one, right? I wish you would have one. that you'd go boom and everything is back to normal. So it's not going to be back to normal. It's going to take some time. But in the meantime, as we have already talked about and everybody's talked about, we've got to observe the precautions. We've got to observe what is being said and not, I know people are going crazy at their homes. They want to get out. Somebody asked me today, a reporter asked me today, what if somebody wants to go jogging? Can they go jogging? And, they really want to go out jogging. There's an article that is coming out on that. And, yes, they can go out jogging. But the thing is, they've got to keep the distance. And I told them that, if they go out jogging in a park or something, please, wherever they go, wear a mask if possible. That's the easiest thing to do. And wear gloves. Because if you go to the bathroom, for example, at a park, you want to make sure that you're not contaminating yourself. And when you get home, what do? I tell them what I do. Take off my shoes outside my house in the garage. Nobody's in front of me at that point. I go straight to the bathroom, take a shower, put on fresh clothes, dump all the clothes immediately in the laundry, and then I can go and be with my family. So, those are the little things that we will have to do. And if we do that, by the way, it's not a bad thing. It's a good thing to do, right? To be clean and all that kind of stuff. But but what's going to happen is that we're going to get used to doing those things. Like we got used to doing things at the airports after 9/11, etc. Mm-hmm. So we have to change our habits, and we are resilient enough to be able to do that, I believe.
So this is probably my final question, and it may kind of repeat some of the things that you just said there. But as we slowly get back to folks getting back to work, what are we going to need to do to make sure that we don't see a surge in new cases?
So again, follow the 3-phase plan. First, there is going to be, we are saying telecommuting as much as possible for work. No fun travel for a little while. Observe all the precautions that are needed. You start seeing the decline, then you go into the second phase, and you have some people go to work, essential people that go to work, and you still do telecommuting, because I believe that the whole nation is going to change after this entire episode. We're going to have more people telecommuting and doing work from home than before. But at some point, a lot of people will go back to work and start doing what they have to do. But in the meantime and afterwards, we've got to observe the guidelines that have been provided. I honestly believe that the guidelines, and I went through that all day today, to see, where I could find something which didn't make sense, and they do make sense. Obviously, I believe the administration also understands that as we move forward, this is going to be a fluid document. This can change, and I believe, and I've talked to a few people, and they said that, listen, this is today. Tomorrow, if things happen in a different way, we might have to do something different. But the whole process, I believe, is going to be phase in, phase out. Stay homes and things like that. So, for example, if we are doing robust surveillance, if we're finding out that there are more cases after we open up, phase 1 or phase 2, then we'll have to go back again to closing things down, and then go repeat the cycle again for phase 1 and phase 2. So it's not going to be easy. It's definitely not going to be easy, but we can't wait another year to start again, I'd say. So we have to start somewhere, and this is a decent plan to start out with.
All right. Doctor, thank you so much. Really appreciate your time. Always a pleasure to talk with you. And I guess we'll be seeing you next week as well for an update on things.
Well, thank you so much. Have a very good evening. And for me, it's evening. So have a good day for you. Bye-bye.
Okay. Thank you so much. Thank you.